Welcome to the office.
Natalia! Manishma!
Welcome.
All right, we're winding up this visit.
Yes.
You came out from Miami.
Correct.
Came out with some stuff.
Yeah. Came out with some stuff.
What kind of stuff?
A lot of pain.
Okay.
Achiness.
What kind of achiness?
Just
to recap.
my bottom right buttocks that would kind of penetrate all the way down to the front of my knee.
Okay.
My neck was always stiff. When I took a deep breath, there was always like a little bit of a pain. And our last steps are probably my arm.
So hold on. I mean, you've been wanting to come here for 2 years.
Yes. No, 4.
4 years.
Mm-hmm.
Okay. So it's not just a little this and a little
Correct.
that. It was probably affecting your life quite a bit.
Oh, yeah.
Okay.
Absolutely.
All right. And we've had about four or five visits.
4 or 5 visits.
And tell me what's happened. Like, everything's been doing well?
Yes,
You see the difference
I see
of
the
what's
difference.
happening?
I definitely do.
And it's a process?
Yes.
It's a little bit of a process?
Yes.
Okay. And we had to go against certain principles and things in the book.
Right.
I had to go against certain things in order to really get the result for you.
Right.
And that was probably the loudest nose adjustment I've done in my career.
Yes.
And it is a tiny bit swollen, but it looks a hell of a lot better. You just need to
breathe.
ice there. And how's the breathing?
Unbelievable.
Okay.
I don't think I knew I had a problem breathing until you did this adjustment.
Okay.
Yeah.
Now talk to me about this hip, because that was the real issue.
Yes.
Indentation, all that stuff. Does it feel any different?
It feels very different.
Okay.
So prior, when I would extend back,
Okay.
I would be in sharp pain. So even just driving, if I try to have a better posture, I would feel something pinching in my bottom right.
Okay.
And after our adjustments, I would also try to click out my hip.
Is it clicking?
It's not clicking.
Okay, good.
What I realized as we've done adjustments, when I bring my leg inward,
Yes.
opposed to before where it was outward,
Okay.
or if I go forward in any way, I can feel it.
Okay. So we need
So
to.
out, I'm fine. Now in, it like radiates, and now it's like to the back.
So
of
hold
my
on.
knee.
So you're saying if you bring it out, you're fine.
Out, I'm fine, and if I push down, I'm fine.
Okay. And
So if I'm
that's
forward and I push down, I don't feel it.
okay. Whereas before.
It didn't matter, right, up, down, left.
Okay. So it's
So
just.
now it's just in, or if I'm regular and I'm forward, I feel.
We want to be mindful of the forward just temporarily. We want to do lots of icing.
Okay.
Remember, we worked on pelvis, we worked on sacrum as well. And if we're rounding our back, just for right now, those tissues need to heal.
Okay.
Okay? So we took a big pressure off the back. It's like taking the 40-pound rock off your foot.
Right.
It just needs a little healing time. And I would say probably in a couple months you're coming back.
Yes.
And try to spend about 3-4 days, 5 days if you can.
Absolutely.
Okay? And it's not so much adjusting. Maybe it's every day, maybe it's not. I don't know. Okay? But what I do know is things are healing now.
Oh, I feel different for sure.
And now the major issue is what? Your arm? But
That's
you didn't come
high.
in for that.
That's how high. No, I didn't. Well, I pick and choose.
Okay.
Now that I'm feeling better, I'm giving it
She
all.
thinks it's a smorgasbord over here, guys. No, she's been a good patient. She's been very responsive, and she's been given some really good feedback in terms of what she's feeling, what she's going through. Okay, raise your left arm all the way up and down. Raise your right hand all the way up. Okay, let's go in the back and see what's going on here. Swelling is down a bit, dude. Wow,
No, I know.
Good.
Yeah.
nice. Can you raise your left hand up, please? Slowly, all the way up and down. Raise your right hand all the way up and down. All the way up, slow. Something's blocking it here. And down. Out to the side, raise them up, both of them. A little bit of hiking on this side. Okay. So down, let me do passive test now, passive range of motion. Let's do 2 things first. Bring your left hand behind the back as far as you can up the spine. Nice. 1, 2, 3, 4. Bring it around. Bring your right hand behind your back. This is testing the anterior component. When we have an AI shoulder, anterior, inferior, more anterior, person can't bring it behind the back as high up the spine. 7, 1, 2, 3, 4, 5, 6. This one was 3, 4. This one is 6. Bring it forward. Next, we're gonna do the chicken wing test. Passive range of motion. Let me do the work. Drop, drop. Drop. Passive, passive. Let it go. Let it go. And we're gonna see which one goes higher. And you can see that it's not too bad. Right?
Right, I could feel the pulling though.
You can feel the pull. This one can go higher. This one gets a little tight. But the major restriction is the anterior component. Okay, it does this. Look, it goes anterior, inferior.
Okay.
The more anterior it's stuck, it's harder to bring it around. The more inferior, it's harder to laterally raise or abduct.
Gotcha.
Okay? And that's all secondary too. Let's make sure all the pressure's gone. Starting at the base of the neck. Do-do-do-do. Do-do-do-do. I just got a little bit of heat up there, but no pressure. There it is. T2, T3, right side. Let's see what we got. Mid back is clear, yo.
Love it.
I got like 1. No. I ain't touching your spine, dude. I'm gonna do a little more of that pelvis for you, okay? It's 0. It's all clear. I just got that one right there.
And that meter doesn't work away from the spine?
It's for the nerves.
I gotcha.
It's for the nerves.
And no nerves here?
It's all coming from here, man.
I gotcha.
It's all coming from here. Number 1. Number 2, body is going to readjust over the next month, okay? You got to keep your movement, please. Feet together, scoot forward. Open and close the knees. Is that the Cuban in you?
Yeah.
All right, left side only. Right side only. She tried to go gangsta.
So when I come in, it hurts me.
Okay, so don't come in then. Hold on, hold it there. If I hold here, open and close. Same or better?
A little better.
Open and close.
Way better.
Right there?
Yeah.
So rotate the sacrum on the right. 3 or 4? 3 more tender. 4 feels a little bit more swollen. Raise your right hand up, all the way up. Down. Right hand up.
Way better.
Wow. Number 3.
Cool. Very cool.
Number 3, right pelvis. Let's go to the film real quick.
That's fantastic.
And let's see what we got. T1, T2, T3. T3 needs to be set a little bit different. T1, T2, this is T3. And TT is rotated as a PR, PRI, but it's a slight side slip. So it's a PRI, but here's the issue. It's a PRI with a side slip to the left, so we have to actually do it a little bit different on that right side. And if you guys really want to know how to do that work, it's not for me to teach guys out there how to exactly correct that. That's not what the intent of it is. But those of you who know what a PRI-T side slip is, and if we do a PRI-T as it is, it's going to be what? We're going to be adjusting into a concavity. So I'm actually doing a PRI-T, but a spinous contact. Come over here. You ready for me?
Yeah.
All right. PRIT spinous contact. 1, 2. And that's the home run.
I mean, wow.
Like butter, baby. That was a buttery home run. Slide up, please. Bueno. chin up a tiny bit. Good. Just receive. You okay there?
Perfect.
That's a piece. That's it. Un poquito más, we'll go on the side. Walk it out. Ow.
It hurt me. It hurts me.
Left side down.
Oh,
Left side down.
I don't want to make you look bad.
It's alright.
Oh my god.
It's all good.
Okay.
I'm alright. I'm alright.
Okay.
You're alright.
Alright.
Alright. Process versus event. Over there. Look straight, please. Bueno.
Perfect.
Good. That's a bit. Let's come back over here. Face down on the highway. A little bit more. One more time. Bring your right hand behind your back.
Wow. Wow.
Do some body work when you get back, nothing deep.
Okay.
Light Swedish if you want, okay?
Okay.
And
Yeah.
just a bit. Just a bit. Holding the right, pushing the left. That's it. A little more. That's it. Walk 2 times, please. And then we'll recheck. What I did was I actually brought the sacrum up on that right side. I torqued it a little to bring it up on that right
That's
side.
so, it feels good. It's crazy when it goes down to your knee and now it's like in different areas of the knee. It's like, what's happening here?
Have a seat over there.
Gotcha.
Bring your right hand behind your back, please. So 1, 2, 3, 4, 5.
Nice.
Left hand behind your back. Good. Bring it forward. Right hand behind your back. And let's do the anterior shoulder now. Let's go back one more on the high-low. We'll do it over here on your back.
Gotcha.
Slide over towards me this way. That's it. We're doing anterior shoulder, anterior here. Left hand on your belly button. Keep your head straight. Slide over a little more. There you go. And what I need you to do is let that shoulder go all the way down into the floor. There you go.
Hi. It's those that I love. Like the immediates. Woo.
Because you have so much patience.
I mean, wow.
What?
I can fly.
Okay. Well, you are flying too.
Yeah, I know.
Nah.
You guys will miss me.
Nah.
Yeah, that was great.
Shasha's gonna miss you.
You too. You don't know yet.
I don't know. Have a seat. She got jokes. Right hand behind your back.
That's great.
1, 2, 3, 4.
Fantastic.
Left hand behind your back. 1, 2, 3, 4. Qué bueno. ¿Español?
Sí.
¿Sí? You hiding it.
Bueno, yo hablo español.
Oh, there it's coming out now, show. Mejor,
Mucho.
mejor. ¿Está claro? Clear. Now you get to do scar tissue work, okay?
So when I go inward like this,
Yeah.
this is scar tissue short ligaments.
Remember this had an indentation?
Oh, yeah, that's it.
No, the butt.
Yeah,
Where is it? Show me.
my indentation, it's almost gone.
Okay,
It's almost
so
gone.
let the tissues heal now, please.
Gotcha.
You want to get a buff and polisher? Get a buff and polish machine. You want to do gua sha? Do gua sha. You have Thai massage down there?
Yes.
You have someone do gua sha for your legs. Don't touch your back. Gua sha.
Wash is when you scrape.
Yeah.
The last time I did it, I went no.
Well, then you
They
have
didn't know
to,
what they were doing. No.
what's that?
Is it normal to go numb?
No.
No. Okay.
Too hard.
Oh, gotcha.
5, 4, 5, 4. Walk it up. You got one last thing to do, okay? I know. Go on your back. This is all just decompressing now.
Wow, I can't believe how much that hurts me.
IT band, guys, when the IT band is so tight, IT band isn't usually the cause, IT band is a result. And it's usually a result of G medius and the hip flexors and abductors, okay? So the idea now is you gotta get all this stuff kind of worked out there,
Yeah.
okay? Not hard, consistent. That's
It's
G
when you're not
medius.
even pushing on it.
I'm barely
It's
touching.
here. It's that. It's that. Okay.
Okay, so that's G medius and that's piriformis insertion. That means healing time.
Okay.
That's all. Stand up, please. Hold my hand there. Raise your right leg. This is your homework. You okay raising it?
Yeah.
A little bit different?
Yes.
Okay. I know, so. There you go.
There you go.
Released. Stay on
This hurts my buttocks area. What did I do today? What did I do?
there. This all started, again, you're asking me the same question.
No,
from the
it's from
beginning.
don't tell me, my tailbone.
It's all coming from where? You have a rotated pelvis and a rotated sacrum and a drop sacrum on the right. When you come back, we'll redo your x-rays. We'll figure out where you're at.
Cool.
Okay?
Yep.
And the idea now is we have to figure this piece out. I didn't even get to your 5 on this trip.
L5?
Mm-hmm.
You want to do it?
Isn't it? I can't get there until all this is done.
Really?
Come sit. I'll show you. She's a difficult patient.
I'm sorry.
Have a seat.
I feel so bad. But I don't, but I do.
You don't.
I just,
Back. That's 5. I'm pushing hard.
I don't feel anything.
Right. Once this stabilizes, once this starts to adapt, this will start to show up a little bit.
Cool.
I don't think that the sacrum and pelvis is gonna fix that 5, it's gonna make it better though. So as I said, let me repeat. Lots of light massage, your movements, you have access to a gym, pedal backwards, lots of backwards pedaling. 10 minutes if you have a bicycle at home or a pedal machine. 10 minutes every morning. You're on your feet all day?
All day.
Okay, so even more important.
Yeah.
Midday, you're icing.
Okay.
You're icing 3 times a day.
Okay.
Morning, afternoon, and evening. Okay? You check in with us in about a week. Let me know how you're doing.
Got it.
And 4 to 6 weeks.
Okay. That sounds
6
good.
weeks you come back. Okay?
Yes, sir.
You're all good. Stand up. Squeeze. Squeeze. Questions?
Okay.
We're good?
Yes.
Okay. Safe travels back.
Thank you so much.
You're welcome, my
Appreciate
good.
it.
You be good.
I appreciate it.
Any
Hush,
other
hush.
comments?
Shush, I love you.
Ah!